12 early signs of kidney disease you should never ignore. The body's entire health and balance are crucially maintained by the kidneys. These essential organs control blood pressure, electrolyte balance, and the removal of waste materials, extra fluid, and poisons from the blood. However, the kidneys can be vulnerable to a number of disorders and diseases that can compromise their appropriate functioning just like any other organ. Liver illness is a silent killer, as anyone who has experienced it, is experiencing it, or knows someone who is can attest. The fact that most people only receive a diagnosis at a fairly advanced stage makes it much more deadly. For early detection, diagnosis, and prompt management, it is crucial to be aware of the signs and symptoms of kidney issues. Few people have the education necessary to understand that kidney disease symptoms are not quiet, but are also common enough for them to disregard. Unfortunately, in other instances, the symptoms might not even start to appear until the situation is serious. Thus, it is all the more important to understand and recognize the signs. By being aware of these symptoms, people can proactively seek medical assistance and make the appropriate lifestyle adjustments to maintain kidney health. We will examine the typical warning signals that may point to kidney problems in this video, empowering viewers to be informed and proactive about their health. Before we get started, remember to subscribe to our channel and turn on the notification bell so you won't miss any of our new videos. Now let's go over the top 12 kidney disease warning symptoms that you should be alert of. Number 1. Changing of your urinary function. The change in how much and how often you urinate is the first obvious indicator of kidney disease. The amount of urine you pass could dramatically increase or decrease. Additionally, you could occasionally notice that the color of your urine changes. When you get to the bathroom, you can still experience this strong urge to urinate, yet unable to do so. The main line is that it's important to start paying attention and recording your daily trips to the bathroom if you notice a change in your urine function. Number 2. Difficulty or pain while urinating. When attempting to empty your bladder, you could experience pressure, pain, or difficulties. This can indicate that you have a urinary tract infection. Although this is easily treatable, it is best to discover it early because it has the potential to spread to your kidneys, making you feel feverish and cause neck pain. Number 3. Blood in the urine. One of the symptoms that cannot be ignored and is clearly a ground for concern is this one. So, if you recognize this, pay close attention to it. A clear sign of renal disease is blood in the urine. If you have noticed this symptom, you should see a doctor right away due to the fact that certain bladder tumors may also be linked to the blood in the urine. Number 4. Foamy urine. Given the close relationship between the bladder and kidneys, the bladder is the first organ to be impacted when the kidneys are failing. I understand you probably think that many of these symptoms are solely related to the bladder. Number 5. Swelling or edema. Your kidneys are responsible for eliminating all the extra waste and fluids in your body. This additional waste and fluid build up in your body when they are unable to accomplish that any longer. When this happens, the person will feel stiffness in their hands and ankles as well as swelling in their feet and ankles. Number 6. Extreme fatigue. A hormone called erythropoietin that supports red blood cells in carrying oxygen is produced by your kidneys when they're functioning properly. This hormone is extremely depleted when your kidneys fail to function properly. Your body becomes weak and worn out due to this rapid decline in red blood cells. Number 7. Dizziness and inability to concentrate. The brain is also impacted by the shortage of oxygen when your kidneys are the source of your fatigue. You might feel lightheaded as a result of this, and concentrating might be difficult to maintain. The brain processes more slowly when there is a lack of oxygen, hence is the cause. Number 8. Feeling constantly cold. You may feel cold in warm places if your body becomes anemic, which can happen if you have renal illness. A fever and chills can also be brought on by the kidney infection known as pyelonephritis. Number 9. Skin rashes and itching. Although the rashes may be a sign of kidney illness or failure, they are frequently mistaken for symptoms of other disorders such as allergies. Kidney failure, which also results in a buildup of waste in your blood, is what causes this. It's this that results in skin rashes and intense itching. Number 10. Ammonia breath and metallic. The amount of urea in the blood rises due to kidney failure. When this happens, the urea is converted into ammonia in the saliva, which results in ammonia breath or unpleasant breath that simulates urine. 11. Nausea and vomiting. You'll feel persistent nausea and vomiting if your kidneys are failing. This will not happen just once. More frequently than not, you will encounter such. This is because the body must eliminate unwanted substances that have accumulated, which is why vomiting occurs. Now lastly, number 12, shortness of breath. If the kidney illness has progressed far enough, it may lead to an accumulation of fluid in the lungs, which may make you feel struggling for breath. In connection with this, your body will deprive itself of the oxygen it needs if you have anemia, another kidney ailment. The kidneys are important organs that carry out crucial bodily processes. Understanding the symptoms and warning signs of renal disease is essential for early diagnosis and effective medical treatment. It's crucial to keep in mind that just because you experience any of these symptoms doesn't guarantee you have kidney impairment. It's crucial to see a doctor for a proper evaluation and diagnosis if you suffer any alarming symptoms, including altered urination patterns, edema, exhaustion, back pain, odd urine color or texture, elevated blood pressure, nausea, or shortness of breath. A healthy lifestyle, staying hydrated, controlling chronic diseases like diabetes and hypertension, and routinely testing kidney function through checkups are all important components of preserving kidney health. Learn about kidney disease, including its causes, symptoms, management options, and therapies. You may make wise decisions and take an active role in your care if you are aware of your condition. Follow the advice given to you regarding your prescribed medications, dietary restrictions, and lifestyle. Effective kidney disease management and minimizing complications depend on consistency and adherence to your treatment plan. Eat a kidney-friendly diet. Create a balanced, kidney-friendly food plan in collaboration with a qualified dietitian who specializes in the condition. Concentrate on eating a balanced diet that prioritizes lean meats, fruits, vegetables, and whole grains while limiting salt, phosphorus, and potassium. Keep in mind that treating renal illness calls for a multifaceted strategy that takes into account your physical, psychological, and emotional health. You can live a satisfying life while successfully managing your kidney illness by taking proactive measures, remaining in touch with your healthcare team, and keeping a positive outlook. People can take charge of their kidney health and perhaps prevent or effectively manage kidney-related illnesses by being watchful and proactive. Your kidneys and perhaps even your life could be saved. If you enjoyed watching Vital Health TV and learned something in this video, please hit the like button and subscribe to our channel for more videos like this.